Joining us live this morning, because it is Tuesday, is Dr. Isaac Bogosh, infectious diseases specialist at Toronto General Hospital. Of course, we're talking all things COVID. Good morning, Dr. Bogosh. It's good to see you. Let's start here. You know, when it comes to what we could be seeing in terms of COVID's evolution, a lot of people sort of looking, crystal balling that. There seem to be plenty of conversations right now about some new subvariants of Omicron, including BQ.1.1. So is there a particular strain we can expect to be dealing with in the coming days? And what kind of challenges does it or any other variants offer at this point?
Yeah, thanks for bringing that up, Nick. That's really important. So yeah, I mean, behind the scenes, we know that this virus continues to mutate, and there's lots of different variants, we'll call them, that are emerging in the background. Now, the vast majority of these will amount to nothing, but some of them might have a competitive advantage, and we might see some breakthrough and be the dominant variant. And I really think that it's really too soon to tell which one that might be, and it might actually be a constellation of them. But one of them that I think many people are keeping an eye on, as you point out, is this BQ.1.1, and it just seems to be gaining a foothold in the UK and other parts of Europe. Not like we're seeing much of it here in Canada, but again, we do lag behind European and African settings by a few weeks, so it very well may be here or may be here soon. And again, it's not entirely clear what this means. I think it's important to recognize a couple of things, though. So far during the pandemic, regardless of the variant, we've seen Alpha, we've seen Delta, we've seen Omicron with BA1, Omicron with BA2, Omicron with BA5. Regardless of the variant, the vaccines that we have always stood up against protecting us against severe infection like hospitalization and death, regardless of the variant. And I think that's a really important thing to recognize. The other important thing to recognize, too, is, regardless of the variant, you can put on a mask in an indoor setting. I appreciate that mandates have been lifted in the vast majority of the country, but you can choose to wear a mask in indoor settings where we know the vast majority of COVID is transmitted, and it doesn't matter what the variant is, that will still protect you against infection. But yeah, there are a few that we're watching, including this BQ.1.1 and a few others, BA.2.752, BF7, a bunch of names and numbers, but something to keep an eye on.
Okay, I was going to ask you about masking a little later on because one of our viewers was asking that question, but I'm sure they've got their answer now. In the meantime, Dr. Bogosh, here we are. We're in the fall. And of course, for months now, we've been hearing about a potential fall wave of COVID-19. So is there any kind of a timetable that we should be looking at? Because, of course, kids have been back in school for just about a month now. And, of course, all the other remaining restrictions, like at airports and on federal trains, et cetera, have now been removed. So are there any indications of an approaching wave?
It's hard to say, right? We don't have that same degree of community-level testing that gives us a more granular view of COVID activity in the community. We can look at wastewater surveillance. We can look at the low but consistent number of tests that are being done and the percentage of tests that are positive. We can look at hospitalization data, which is still flat. And it's not entirely clear in Ontario at this point in time. If you take a step back and look at Canada as a whole, or other particular provinces like Quebec and BC, for example, you are starting to see a small but real uptick in COVID-related illness, including hospitalizations. It's small, but it's there. And, I can't look you in the eye and tell you with a straight face when it's going to happen, but it would come to no one's surprise that at some point later on in the fall or in the winter, we're going to see a real rise in cases. And of course, we've chatted about this a couple times before. You couple that with we're going to have a flu season this year as well. That's likely on the horizon. Unfortunately, other respiratory viruses and the regular ailments that people get in the winter. There's things that you can do to protect yourself. We obviously just chatted about COVID vaccines and masks, but flu shots will be rolling out as well sometime in the fall, probably sooner rather than later, and it's a great idea to get a flu shot as well. Just steps that people can take to protect themselves against illness, keep them out of hospitals, keep them from going to the doctor's office, keep them healthy, and we are empowered to do this.
Right, and of course we'll have probably a lot of family gatherings over the weekend, as this is Thanksgiving, so we'll see some of that too. In the meantime, Dr. Bogosh, this isn't COVID-related necessarily, but we're also seeing cases and deaths that have been connected to Ebola and cholera in other various places around the world right now. A few months ago, we saw that monkeypox outbreak, and that sort of arrived here. So how concerned do we need to be about these new outbreaks globally, especially in the light of the removal now of all those travel restrictions just over the weekend?
Right, so from a global standpoint, listen, I'm totally biased. This is what I do for a living, and I think it's extremely important because it impacts, not everything's going to impact us here in Canada, although we do live in a very interconnected world, and we know, and we've seen time and time again how some things can, emerge on the other side of the planet and then land on our doorstep. But not everything is going to be a huge threat to Canada, but that doesn't make it any less important. And I still think we need to think of these as global phenomenon. And it's no secret why we're seeing more and more what we call emerging and re-emerging infectious diseases. There's a lot of common themes here. We've got degradation of the environment, where we know the animal reservoirs for these infections reside, and humans coming into contact with animal reservoirs. Some of these, not all, but some of these infections are transmitted by mosquitoes and other vectors like that. And we know that climate change can expand the home range of those mosquitoes. So you've got a broader range of mosquito-transmitted illnesses around the world. And then, of course, like we touched on, global connectivity, where you can bring infection A from one part of the world to another part of the world in as little as 24 hours. So we should be keeping an eye out for these. Sadly, we're going to see more outbreaks. And, we do need, if COVID taught us anything, well, it taught us lots of things, but we do need a coordinated global response to this. We cannot act regionally. We have to act globally.
Yeah, and I know how much you do keep an eye on and even go to those global places where situations are happening. We're pretty much against the clock, Dr. Bogosh. One quick question. Is there a chance we see a flu and COVID vaccine in one? Is that in the works at all?
Yeah, I mean, I think, listen, it's not going to happen this season, but it certainly is a possibility. One of the challenges, and I know we're out of time, so I'll keep it short, is you've got to get the right flu vaccine, and you got to get the right COVID vaccine, and you got to get them at the right time, and then you got to stick them together. So it's not without some hurdles, but it certainly is a possibility, but it's not going to be happening in the 2022 calendar year, that's for sure.
Okay, so we roll up our sleeves multiple times, it seems. All right, Dr. Bogosh, appreciate the time again this morning. We'll chat again on Thursday. Thanks so much.